Welcome back to Your Health Matters. I'm Jamie Taylor, and I'm really glad you joined us today. My guest is Liz Briere from our Dizziness and Balance Center here at Kingman Regional Medical Center. We're talking about vertigo and balance. Welcome back, Liz. Good to have you on the show.
Thank you, Jamie.
Earlier we talked about the whole little rocks in your head that can cause vertigo and balance issues, but you were sharing there's other things as well that can lead to that. What other things are those?
Well, people can have just motion sickness or motion sensitivity, where things such as riding in a car or if they're riding a bicycle can bring on some nausea and sense of motion sickness. There's other things such as migraine-related vertigo, called vestibular migraine, and that can actually be a fairly common issue and can really bring on some abrupt episodes of dizziness. What's interesting is people do not necessarily have a headache when they experience.
Oh, really? I always assume migraine. I've never had one, thank you.
Right.
But,
but nope, not necessarily. They can just have the dizziness.
Oh, that would be kind of scary.
It can be scary.
Not knowing where it came from. So what would cause something like that? Do you know?
Well, just like with migraines, it's more of a arterial type of issue where it's bringing on the dizziness. The difference is that they don't always have a headache. They can have the nausea, they can have the nystagmus where their eyes feel like they're jumping in their head, and they can have the vertigo, and it can last hours to days, and then it usually will just resolve on its own.
Okay.
But what's really important is when someone is experiencing that is to seek the necessary care so that they can be educated on things that they can avoid. Sometimes it's food, sometimes it's certain type of lighting. And then in some cases, they also need to get on medication to help manage it.
So if someone has those type of symptoms, like we talked about earlier, the first thing they need to do is go to their primary care
most definitely
physician, and then that doctor would refer them to Katie Brown for the diagnosis, and then to the Dizziness and Balance Center for the therapy side of it. Okay.
Right. Exactly.
So how did you decide to become a physical therapist? This is very interesting.
Well, I actually, when I had returned to school, I was in my late 20s, and I had worked in the hospital in the billing department and had come across physical therapy and occupational therapy when I was trying to help with set up billing codes, and just found it fascinating. And after that, the rest is history.
So you went back to school here locally?
I went to school. I'm originally from Connecticut.
Okay.
I graduated from the University of Connecticut with a Bachelor's of Science. I'm currently working on my doctorate through Des Moines University.
Very good.
And then I moved to Lake Havasu approximately 8 years ago, where I still reside.
So you drive from Lake Havasu every day to work?
I do, and I don't mind a bit. I really enjoy working here, and I think that says it all. It's important to enjoy what you do and where you work.
Absolutely. I think, like we shared earlier, that to me, KRMC is a blessing to our community and to the whole Tri-City area. I mean, we have services here that a lot of the other hospitals in our area don't have.
Right.
As well as the diagnostics that a lot of hospitals in Vegas and Phoenix would give their eye tooth, as they say, for, because we're not for profit. What's awesome about that is it allows us then to take those monies that we do make and invest them back into our hospital or into the community, which is why we have the state-of-the-art technology like the Dizziness and Balance Center.
Yes.
That's a brand new service. Like you said, it's been less than a year that we've had it here. So you enjoy working enough at KRMC to make that, was it about an hour drive?
It's about an hour drive.
Each way? You do books on tape? Or
No, I don't. It usually goes by pretty quickly.
Oh, that's good.
Yeah, I don't mind it.
And like we talked about, it's good to come up here and cool off, right?
It is, especially during the summer months.
Yes. So you go home to warm up in the winter, and then you come up here in the summer to cool off. It works out well. That's a good. And do you have children?
I do. I have a 14-year-old son.
Oh, wow. Yep. Very good. So he goes to school in Havasu.
He does.
So you're going to follow in Mom's footsteps? You can make him a therapist?
I don't know. It's hard to say right about now. He really enjoys computers. So
very good.
Time will tell.
Yeah, we need that too. Yeah. So are there other things, Liz, that you can think of that people should be aware of when we're talking about dizziness and balance?
I think the most important thing is when you're experiencing that is to seek the necessary medical care and consult with your doctor so that they can find help direct them to the right person so we can try and address those issues. I think it's really important not to ignore them or to put them aside thinking, well, it's just normal, I'm getting older. I hear that from people a lot, and it's not normal to be dizzy, and what's really important is there's things that can be done about it. That to me is the most important thing, is once you start experiencing it, is just to consult with your doctor.
Now, does insurance usually cover
They
these
do.
types of things?
Yep.
Okay.
Our insurance covers physical therapy.
Okay.
We accept all insurance types. So, yep.
That's good. Well, it is important, and especially nowadays, because I would think that if it's not treated, untreated, dizziness and balance issues can obviously lead to other things, even falls with breaks, and of course it can cause more serious health issues. So, as you know, with most symptoms, if you catch them early, you're going to have fewer complications down the road than if you ignore them. And that is, especially now, people have challenges with healthcare coverage a lot of times, and so they don't want to go to the doctor until it's really necessary, they think. But like we said, if we catch it early, we can probably fix it sooner.
Especially if they're at risk for falls, because that's dangerous. They can result in broken hips, just trauma. Just falling in itself makes people more, and it makes them more fearful of falling, and then they start changing how they walk and limit their activity, only resulting in further muscle weakness and loss of function, increasing the risk of falling even more. So I think it's just really important to try and address the issue.
It sounds like that, and for long-term care as well. Are there programs, and once, like we mentioned, that they get the wonderful benefit of a free month's membership here at the Wellness Center afterwards, and then do they have a program, like a follow-up program that they do, or do you send them home with exercises to work on?
Whenever I see somebody, I always send them home with exercises, because it's important for someone to have tools that they can use to continue on to help manage the issues. And a lot of times it is continued exercising. And then of course once they receive the 1 month membership, they always have the option of joining on. And we have some great programs here where there's a lot of different type of packages that they can get, where they can sign up just from month to month, or sign up for a series of several months, or for a full year. There's also aquatic exercise classes that a lot of people enjoy doing, and it's a wonderful group event. So I think there's a lot of different options to continue on that good healthy path.
And I know they even have special rates, so if you come in, like if they're retired and are more flexible in their hours, they can come in during the slower times, so there's special discounts on that. And they actually even have a scholarship program here at the Wellness Center.
We do.
For those people who have medical issues and maybe can't afford an ongoing membership, that there are scholarships available. So
yes, there is.
They just have to check in at the front desk, I think, at the Wellness Center to get more information about that as well.
Yep, they do.
Okay, and that's, we're blessed. We've got an awesome staff here at the Wellness Center, and I know you work with a great team. Is there anybody in particular, or if you want to mention the rest of the staff that you work with?
Well, I love working with our audiologist, Dr. Katie Brown. She's a great addition to our Dizziness and Balance Center, and really all the physical therapists that I work with. Meredith Senna, Tori Taylor, Erin Nichols, they're all really great people. And then Sean Butler, who's my clinical coordinator, he's just a great guy to work with.
Now, do you work with patients in the hospital too, or is it mostly outpatient?
Well, we all take turns, and we all will spend some time working in the hospital and helping people that may just need to relearn how to get out of bed and
so
how
you
to
help with those things when
we
they're
do.
actually in the hospital.
Yep, we do.
I know we've had, I forgot, Jill, I think it is, from Acute Rehab that was on the program a couple of weeks ago and talked about the Acute Rehab program there and using the Wii as part of their rehab program, which is always fun to think about how you can use those games and still use exercise.
They're great. They have some great balance exercises on there.
Very good. So there's a wide range of tools obviously
There
available that you can put to work out there. Is there anything else that you can think of that you'd like to share with our listeners or watchers about the Dizziness Center or here at KRMC?
Well, just to know that we're here to help, and I hope people come by to, if even if they don't have an issue and they have a family member that has an issue, please come by. We love to try and help do whatever we can to help people out. And if they just want to stop by and ask some questions, then they're more than welcome to.
Well, and I was just thinking too, I forgot we've got the rehab fair coming
We
up in
do.
September.
Yep.
We should probably make sure our audience knows about that.
Yes.
That's September 17th, I think.
Yes, it is.
Right here in the Wellness Center from 10 to 2. And I know I just learned yesterday there's a Comfort Keepers is a group here in Kingman in the Tri-City area, and they're going to have a live remote with Mad Dog Radio out in front of the Medical Professional Center, and they're going to be doing a food bank or food raising for senior hunger.
Oh, okay.
So as folks come to the rehab fair, they can bring in their canned goods and foods for the food bank, donate them, and then come on in and learn more about rehab. And I'm sure
Right.
you'll probably be there for that, right?
Most certainly will be.
Okay, good.
Yep.
Well, Liz, thank you again for being on the
Thanks,
show, and
Jamie.
we really appreciate it. And we thank you for being here and for our audience watching us today. And again, they're going to stop at 1739 Beverly Avenue if they have more questions. Is there a phone number they should call, Liz, for the Dizziness and Balance Center?
Well, they can call our main number, which is 692-4630.
4630.
Yep.
Okay, so if they have questions after watching the show, they'd like a little more information,
Right.
they could call in 692-4630.
Yep.
And I know we have information on our website as well, and
Yes,
that's azkrmc.com.
Right.
So there's all kinds of information there as well. Okay, well, thanks again for being on the show, Liz.
No
We'll hope
problem.
you have come back again sometime and join
Thanks.
us. And thank you all for being with us today as well. We'll talk to you soon. Stay tuned for another show.